All right, so before we begin, let's talk about the tools that you're going to need throughout this process. Now, tools for documentation is important. As you can see, I suggest using old-fashioned pen and paper because that is reliable. However, these processes can be anxiety provoking, and sometimes writing them down, if you're not in total control of your emotions or don't have the best memory, that's why we rely on technology. So digital recording can be used, notes, as well as direct messaging via the My Health eVet account. Either way, when you're documenting your interactions with these professionals, it's important that we always obtain the name of the person that we're speaking with, their first and last name, the time that we spoke with them, to include the date. Those are important references to go back to once you're conducting your follow up. All right. So once you have the individual's name, the date, and the time that you spoke with them, then you're going to write down a summary of what you all spoke about during your conversation. And so when you are speaking with your community care caseworker, you want to make sure that you're able to say, hey, I spoke with you on this date. You let me know that you uploaded the documents in your system and you are waiting for approval from whatever VA specialist department, your dentist or your doctor that you're waiting to see, and you're just calling to check on the status. And so it's always important to have the documentation. One, it indicates that you are serious about your care and you're advocating for yourself. And two, it helps them be able to navigate the process so they won't be repeating the same information and thinking that you're just trying to annoy them, right? Because you are a real person, you are the veteran, and you are needing to receive care in ample time. That is why you're going through the community care process, and that is why documentation is vital and important. Now, the My Health eVet account is also going to be one of your lifesavers because it is a direct messaging service to your provider. So once you get further along in the process and you email your provider, they will be able to say, okay, they reached out to me, you know, May the 20th. It's now May the 22nd. Let me go ahead and review their treatment plan so it's too much time won't elapse. And if it does, you'll also have a running record that you can report to the patient advocate if the medical providers are not acting in ample time. But most likely they will be once they see that you're advocating for yourself and taking care of yourself. Remember, you are not the only veteran that is going through the process. There's thousands of us there, and we have to be patient, but we also have to be stern in advocating for ourselves. So that is why I suggest you use these tools for documentation purposes. And again, it will avoid you repeating the same questions and getting the same information. And also, you need to record key numbers that you're able to get through and extensions as well. But we'll go through that in the next couple slides. Okay, so let's talk about the step one, the initial exam, meeting with your primary care provider and VA specialist. All right, so step one, the first thing you're going to do is you're going to call your primary care provider and you're going to make an appointment for your specific condition. All right, your primary care provider is then going to set you an appointment. Make sure you use your documentation tools and document the date and the time of your appointment. Once you arrive at your appointment, the primary care provider is going to conduct a general exam. Remember, the primary care provider is like the gatekeeper, right? They are generalists, which means that they were trained in a myriad of medical areas, but they don't specialize in one specific area. So whatever condition that you're having, they're not specialized in, but they can, however, examine you and determine that there is a need. Now, after your primary care provider conducts their initial examination, they're going to refer you to see the VA specialist at the VA hospital. All right. Now, when they do that, make sure that you document what the primary care provider said. The primary care provider said, okay, the exam is complete. I am going to set you an appointment so you can be seen at the VA hospital. You say, thank you, I appreciate that, and I will follow up with you on that. So once you leave, more than likely you will have a date and a time that you need to see the VA specialist. Now, if the VA specialist assistant, their nurse or whatnot, does not call you within the next business day, then you need to call your primary care provider, verify that they finished the paperwork and they put in the authorization for you to be seen at the VA. All right. Now, once they have confirmed that they have done that, then you need to call the VA hospital and you need to request a phone number and extension for the specific department that you need. So let's say you need to be seen by dental. You're going to call the VA and say, hey, can you please refer me to the dental? And before you do that, could you please provide me with the direct number and extension? You're going to write that down on your recording device to make sure that when you call back, you'll have a direct number so you won't have to go through the operator again. They're going to provide you with that number. All right. Now, once you finally get through and you talk with the VA specialist representative, probably their nurse or the information taker, you let them know, listen, I was seen on this day because you have documentation by my primary care provider who informed me that I was going to be referred to see a VA specialist. So I'm calling to make sure that you receive that information and I need to set an appointment. Now remember, this is the next business day, okay? Because you have to, if you have a condition that needs to be attended to, you're going to have to advocate for yourself. There are thousands of veterans using the same service and most of us are numbers, and but ones that have conditions that need to be seen immediately, we have to be stern, but be fair and gentle in our response in receiving care. So once the VA specialist representative says, oh yes, I do see where a referral was put in here, let me go ahead and schedule you a date and time to be seen, you're going to say thank you. And once they provide you with that date and the time, you're going to write that down. And you're going to say, before we get off the phone, is there a direct number where I can call and reach you by? And then they're going to give you that number, and then you're going to ask them, what is the usual time frame? Um, well, no, disregard that part. You're going to get the direct number, and then they're going to set you up a date and a time. So once they set you up a date and a time, you're going to make sure you document that, thank them, and then that'll be the end of that interaction. And what you're going to get their name. That's what I'm going to say. You're going to get their name, right? That's very important. Make sure you get their name, right? And so on your documentation at this particular point in time, you should have the date and the time of your initial appointment. You should have the name of the VA specialist representative, their nurse that you spoke with, and what they said. So on May the 20th at 10:45, I spoke with Nurse Green, and she said that this is my appointment, and she looked forward to seeing me into that documentation. But make sure you get the person who you spoke with, their name, and the date and the time. Now, once you have your appointment is confirmed, you are going to arrive at your appointment at least 30 minutes beforehand. Okay? Once you arrive at your appointment, you are going to be seen by the VA specialist. Now, the VA specialist most likely will be trained in the specific area that you need. Now, the VA is overwhelmed, right? There's thousands of veterans with similar problems, which is why the community care program even exists to begin with. All right. So sometimes you might not see an actual medical doctor. You might see a medical student. Make sure you document that. You might see a person who has just been working in the field in that particular area. Make sure you document that as well. All right. But if you are lucky enough to see an actual um, certified VA specialist, what they're going to do is they're going to conduct an initial examination. All right. Now, this examination is done for several reasons. All right. Now, the main reason is because you are needing a service. They need to examine you based on their expertise to determine the level of service that you need and what you need done. And also too for the records of the VA. So when you are being seen by the community care provider and the community care provider submits their treatment plan, which we'll go over later, the VA specialist will be able to refer back to their notes from their initial exam and say, okay, based on my initial exam, this is what I saw. This treatment is justified and it's in my records, so we can go ahead and get that approved, right? So be very kind to the VA specialist that is conducting the examination because they are going to be the ones that's going to determine whether or not your treatment can be approved in the community. All right. So once the VA specialist conducts their initial examination, then they're going to say, okay, based on my examination, based on my expertise, I see that there is a need for treatment. Unfortunately, however, I cannot provide this treatment in ample time, which would be 28 to 30 days, because of the scheduling of the other veterans that are needing and requiring service. They're going to ask you, would you like to be seen in the community? Or you're going to say, I would like to be seen in the community. Either way, they're going to say, no problem. And what they're going to do at the end of the examination is they're going to conduct their notes and they're going to say this person is the veteran is requested to be seen in the community. Based on that note, then a referral will be created. So before you leave, you get the name of the VA specialist. You say thank you so much for referring me to the community. Make sure you get their name and you write that down, and then you say, do you have a direct contact number? Then they'll probably say, you can contact me on my health evat directly, which you can. That's another documentation tool that you're going to need, which will help you navigate the process, right? And have a running record of exactly who you saw and what's going on, okay? And so once the VA specialist has conducted their initial examination, they have your condition on the record. They can see exactly what you need done in the community, and therefore they know if the treatment plan, which we'll get into on the next one, should be approved on the services that's being provided. Because again, this is all under insurance. But the reason for the examination is to determine that you do have a condition, and the referral is to make sure is for the insurance purposes. Now, I'm not quite sure if based on the referral, the authorization code is made, but either way, once they say you are going to be seen in the community, you're going to have a community care caseworker assigned to you specifically. All right. Now that should be the end of step one. And make sure throughout your documentation you've documented the name of everyone you've spoken with, the dates and the times of your initial examination, the authorization for the examination that was told to you by the VA specialist. All right. And that's the end of step one. So now we are moving on to step two, meaning that you are in the community care network now. So if you're in the community care network, you're going to have a community care caseworker. Now, most people are not aware of this. It depends on how proactive you are in your care. But if you're watching this video, we're advocating for ourselves, so we're pretty proactive. So what we're going to do is, if you live in the North Texas area, you're going to contact the number below. If you're in any other area, you are going to contact your local VA hospital and ask them for the number for the community care network. Okay. So once you get that number, you're going to dial it, and then you're going to ask, somebody's going to pick up. You're going to ask them for their name. Make sure you get their first and their last name. And then you're going to say, hey, I've been referred to the community care program. Will you please help me find my community care caseworker that was assigned specifically for me? They're going to say, sure, no problem. So what they'll do is they'll provide you with your specific community care caseworker. They're going to give you their first and their last name, their email address, and their contact number, their phone number. You're going to say, thank you so much. Is there any way you can transfer me to them? If they can, then that's great. If not, you're going to say, thank you. Right? It depends upon your need. Every situation is different. But now you have your specific community care caseworkers information, so you can send them an email. And this is going to be done as soon as you find out that you have been referred for the community care program. So you're going to send them an email, say, hey, this is my name. I am assigned to you. Will you please contact me as soon as possible? They're going to contact you. Normally, they're going to introduce themselves, and then they'll provide you with the provider. Okay. Now, I'm not quite sure at this particular point in time how close Tri-West and the Community Care Network they speak with each other, but you're going to be getting several phone calls. So one phone call, Tri-West is going to call you, and they're going to ask you for a list of preferences. That's going to take about 10 to 15 minutes. Okay. So get that done. Then they'll say, okay, we'll call you back to schedule you an appointment with the provider, right? And you say thank you, right? But we're proactive, so we're contacting our case managers from the community care network, and we're getting it moving because we have a need for service because we're utilizing the community care program. So once your caseworker has assigned you a provider, you need to do your due diligence. Look up the provider's email address, look at their reviews, look at their rates, and do as best as you can to see whether or not you will be comfortable with that provider. If you feel you will not be comfortable with that provider, then you do have the option to go to va.gov under their service providers and find a provider that is offering a service that you need that's within their network. And I have linked that below for you to be able to do that with instructions. So don't worry about that. All right. So once you're talking to your community care case manager, you're saying, okay, I have done my research and I am going to go with the provider that you suggested, or I have a different provider I would like to see. Then they will say, no problem. Then you're going to say this very important phrase, will you please provide me with my authorization number? They'll say, sure, no problem. Take that authorization number and you're going to write that down in your documentation. All right, that's going to be critical for you. Now, the authorization number is the VA basically saying this veteran is covered to be seen for another initial exam. All right. But this initial exam is going to be done by the community care physician. All right. And with this initial exam, some basic services are going to be covered. So if we're speaking about dental, they're going to say, yes, you can conduct the initial exam and you can get a cleaning, basic services, nothing that requires in-depth treatment. That is different. If you're going for medical, they're saying, yes, you can conduct an initial examination of the patient's, body or whatever, and then maybe you can do an adjustment. I'm not quite sure, right? But that initial authorization number is like your script. So you are covered under the VA's insurance to be seen for the initial examination. So now, once you have that, and once you are seen in the community, they're like, hey, veterans, we love to work with veterans. Thank you for your service. We're so happy you're here, and you're saying thank you and you're feeling really, really good, right? And so what they have done now is they have conducted initial exam, and based on their expertise, they have created you a treatment plan. Now, before you leave from the community care physician's office, you need to speak with the insurance person. The insurance person is going to be the ones that are going to upload your treatment plan. That's another keyword in this next phase. Treatment plan. All right. So you ask the insurance person, okay, when are you going to upload my treatment plan? And they will say, I'm going to upload your treatment plan as soon as you leave. You say, thank you so much. I appreciate it. Or they might say, it'll take me a couple days to get it all the codes, but I'll get it uploaded. And you say, thank you. Once you have confirmed with the insurance person that they have uploaded your treatment plan, then you contact your community care caseworker slash manager and you say, hey, listen, on May the 28th, I spoke with whatever the insurance person's name is from the office, and they let me know that they have uploaded my treatment plan. Will you see if you have received it? Then your community care case manager slash worker will say, sure, let me see. Then I'll say, I have received the treatment plan. And then you say, perfect. Now that you have received the treatment plan, will you please contact the VA specialist representative and let them know that my treatment plan has been uploaded and is awaiting for approval? And they'll say, sure. Make sure you use these keywords because this indicates that you know exactly what you are talking about and you are on top of your care, right? And so also inform your community care case manager slash worker that not only will you be doing the same, you will be following up and contacting the VA specialist representative to let them know that your treatment plan has been uploaded and waiting for approval, but you are going to email the VA specialist via My Health eVet to let them know that you are aware that your treatment plan was uploaded this day by the insurance person and is awaiting for your approval. So that way everyone is aware that you are waiting for your treatment to be approved. You have contacted your community care caseworker slash manager and let them know. Well, first you have talked to the insurance person from the community care physician's office, and you have verified with them that they have uploaded the treatment plan. Then you have contacted your community care caseworker and let them know that you've spoken with your insurance person and they have uploaded the treatment plan, and your community care caseworker has confirmed that they have received the treatment plan and they have uploaded it in their system and they are awaiting approval from the VA specialist. Then you have notified the VA specialist representative that you are aware that your treatment plan has been uploaded by the insurance person. You are aware that the community case manager has uploaded it in their system, and you are waiting for the VA specialist to approve it and review it and approve it. And then you are going to send an email via My Health eVet to your VA specialist, letting them know that you are aware that the insurance person uploaded the treatment plan. You are aware that the community care case manager slash worker had received said treatment plan and had uploaded it in their system, and you have notified the VA specialist representative that the treatment plan has been uploaded. And now you are waiting on the VA specialist to review and approve your treatment plan. All right. Now, be advised, during this time, the VA specialist is still continuing to see other veterans that are in the VA hospital. So it might take them 24 to 48 hours, but it should not take them longer than a week because they have already done the initial examination. They have it on file. They are experts in their field. They should be able to go through the codes, and they should be able to, based on the treatment code that it was suggested, whether or not it aligns with what they saw during their initial examination. All right. So that is step 2 in a nutshell. You receive your authorization number. Your authorization number is simply an authorization for an initial examination, basic services, and a treatment plan. You have contacted your community care case manager, who's going to help see you through the process, and you are making them aware that you know exactly what is going on. You have contacted the VA specialist representative to let them know that you are needing to speak with the VA specialist. If you can help streamline that through, I'd appreciate it. But you are waiting for approval, and you have emailed the VA specialist to let them know, hey, listen, based on your examination, I went out, I received another examination, so I need you to check this community care physician's work to make sure that the treatments that they are requesting can be approved. All right. Now that should take about seven business days. Now it is unfortunate that the VA specialist has such a heavy duty to bear, but because everything is pretty much standardized and most of us have the same common problems, it shouldn't be an issue. Is what I'm saying. All right. So make sure you advocate for yourself. Make sure you're using those key words and terms so that the professionals on the other end of the line know exactly that you know what you're talking about. Now, if you have completed all of these steps and you do not receive a response in a timely manner, which will be 28 to 48 hours, then contact patient advocate, leave a message because no one's ever there. Leave a message, wait for them to call you back, and repeat the process. Documentation will be critical. Okay? Then we're going to be moving on to step 3, which deals with the approval codes. But that is step 2 in a nutshell. All right, so the third and the final part deals with approval codes. So once everyone has been notified that the treatment plan has been uploaded, the VA specialist will then go through said treatment plan, and they will provide approval or denial based on the codes that were submitted. They're going to look at their initial examination, and they're going to say, okay, based on this initial examination and from my expertise, what the community care physician is requesting is reasonable and it is approved, or it is not reasonable and it is denied. Or I feel like that uh, I'm going to deny it because this particular service is similar to ones that they are already requesting. Now, as a veteran, you have the right to access those approval codes, and you also have the right to ask for justification for each denial that was received. Okay, so but once you receive the approval codes, you should be good to go for most treatment. I know as it relates to dental, some of the codes are similar and are the same. But if your community care physician is truly stressing on a procedure that they feel that you would need based on their examination, then they're going to have to either battle it out of professionals, or you're going to have to make another appointment to see the VA specialist again so they can re-examine you and try to find justification for why the community care physician is requesting those particular services. No, I haven't had that issue, but I have had a denial based on similar requests for the same product. Now, that's the third step. In a nutshell, the third step is approval codes. Once your treatment plan has been approved, you're going to contact first you're going to contact your community care caseworker slash manager and say, has my treatment plan been approved? They're going to say, yes, it has. Then you're going to say, will you please send me a copy, or will you please email me a copy of the approval? They're going to send you a PDF file, and it's going to have the list of codes that were approved and the ones that were denied. Make sure you read it thoroughly and you understand it. Now, be advised, when you're dealing with insurance and private practice and things of this nature, things get a little tricky. And sometimes, being the veteran, you might get caught in the middle of bureaucracy, and those thank you for your services, and those nice compliments stop coming because, depending on if not you did your due diligence, um, you will find out very quickly if the provider in private practice is actually there for the veteran or there for the number, right? And business is business, yes, but also too, accepting insurance from veterans and the VA means that you're going to guarantee to receive payment. And we are more than just a number. We are more than just a paycheck. We are actual people with actual issues that need to be serviced, and we need to receive the quality service. Okay, so that's why I made this video. That's why I wrote these notes, to make sure that us veterans advocate for ourselves, because sometimes, um, you'll get into shady situations to where people in private practice will try to cut corners, trying to build their practice off the VA, and then, provide you with bad service. And that's what we don't want. And so that's why knowing keywords is important, and navigating and advocating for yourself is equally as important. It is my intention that no veteran be left behind. I tried to cover as much as I could. Remember that dental and medical are different. The dental service insurance is Delta Dental. That's what the VA uses, Delta Dental. And so if there is something that is not covered, contact them. TriWest has no hand in that. Also, too, if you are not getting through using the community care number locally, you can call TriWest in different cities that have less veterans. It's just a way around it that I found, because North Texas is pretty swamped with a lot of veterans. But no veteran left behind, and this is overcoming isolation. If you have any questions, let me know. Thank you.